Hi, I'm Agnes. For this presentation, I will show you my business plan on how I will start up AllCare Family Clinic, a private clinic that will solely be owned and managed by me, but will eventually welcome future partners. For this startup capital, I have decided to restrict my sourcing to just three major sources. My startup requirements include $500,000 for my personal savings, $200,000 from Kaiser Permanente for expense subsidies and our physician salary for the first year, $500,000 financed by me with a 20-year mortgage for the purchase of the building. This mortgage will be listed under the long-term liabilities. For a specific role, I will be responsible for ensuring the general health of our patients and creating an effective and profitable business medical practice. Throughout the first year, I will work closely with my mentors from Kaiser Permanente to get the clinic on a sound financial and operational footing. It is also my role to provide the vision and direction for the clinic. I will set the course for the values of the clinic, develop its outcomes and service strategies, and set the tone for its relationship with the patients and customers. Though I have a strong experience in health management services, public health, and medical research, I will still hire the services of business medical consultant to provide in-house professional support. For my market segmentation, this is the plan. Since the clinic will be open to patients of all ages, the market segmentation breaks potential patients out into Stevenson Ranch resident within 25 miles and patients from the nearby surrounding areas within 50 miles. Currently, there are only two family doctors in Stevenson Ranch, with 8,000 people living within 3 miles. For me, these are favorable statistics that offer an excellent patient to doctor ratio. AllCare Family Clinic will be located and concentrate its service on the entire Stevenson Ranch community within 25 miles. My segmentation strategy is geographic for three reasons. One, Stevenson Ranch and nearby surrounding patients of this community will not and often cannot travel more than 20 miles to see a doctor. They would rather wait it out on all but urgent matters. Two, All Care Clinic is a family clinic and will treat patients of all ages, incomes, physical abilities, races, and traditions. Three, according to the 2018 Local Area Economic and Demographic Profile Report, the expected growth of Stevenson Ranch residents is at 1.3% a year. So this makes a perfect location for an approximately geographic marketing approach. My target is for All Care Family Clinic is to be the number one choice of all residents of the Stevenson Ranch. That is why I will ensure the follow due process in setting up the business to achieve my goals. For the clinic to set the business industry and that it is built on a solid foundation. For the advantages of my business plan, I have identified the following benefits. Competition among family clinics in Stevenson Ranch and the surrounding areas are small. The growing population base and the limited number of doctors create enormous potential for meeting the patient needs. To be highly competitive in the healthcare industry, it means that my clinic should be able to deliver quality patient service and should be able to meet the expectations of patients at all times. When selecting a family doctor, most patients look for someone knowledgeable and experienced who will listen sensibly to their health concerns. The clinic is well positioned, visible in a secure location, and with ample parking spaces. My staff will be well groomed in all aspects of healthcare service delivery. Our services will be carried out by highly trained staff who knows what it takes to give our patients value for the money. There are also some disadvantages that all care family clinics should be aware of or might encounter during the planning implementation phases. They are not involving the right medical staff or employees. One of the keys to effective business planning is involving the right medical staff or those with the information and perspective that can best influence the process. Extended clinic hours, Staff might be dissatisfied with staggered schedule, plus this will be an additional operating cost for the clinic. Office configuration, staff could work against each other if they are positioned closely. An example would be lack of outlets for personal workspace. Centralized appointment practice. The clinic will have difficulties managing the demands if it does not have timing controller board and won't be able to accommodate healthcare effectiveness data and information set record screening. AllCare Family Clinic has built an efficient, time-tested implementation plan that lays out the milestone from contract signing to the day of the clinic's opening. This 120-day timeline takes all the guesswork out of the implementation and provides measurable goals to ensure that our clinic is ready for opening day. A lot of work has already been accomplished by the time implementation begins, including discussing program specifics, clients' needs, and logistics of operating our on-site. The plan is to start with a client kick-off meeting to flesh out goals, deadlines, and client needs. During this time, we will confirm details like service offerings, equipment, site layout, and to ensure that everyone is on the same page. The kickoff meeting is only the first of many weekly progress touch points. For the projected revenue, please look at the graph for the estimated profit for the clinic's first year operation. I provided estimate for self-pay, Medicare, Medicaid, and other insurances. This projection was done based on what is obtainable in the industry and with the assumption that there won't be any major economic meltdown and natural disasters within the period. Please note that this projection might be lower and at the same time it might be higher. It is important to say that I base my projection on the data collected during my feasibility studies, market survey, and also some of the assumptions readily available on the field. I critically examined the healthcare market, have analyzed the chances in the industry, and included some assumptions that are usual to similar startup in California to come up with this projection. And for the operating expenses of the clinic, I categorize my expenses in four categories, namely salary, wages, staff benefits, other expenses, capital expenses. A total of 720,604.62 is allocated for the first year of the plan. AllCare Family Clinic expects quality outcomes that measure the changes in patient health, function, or quality of life which is a result of patient care. We will utilize quality measures that can be reported by our patient and their families, which are called patient-reported measure (PRMs). PRMs can be either patient-reported outcome measures (PROMs) or patient-reported experience measure (PREMs). We will use established PROMs to fit our patient population. At this time, we have not yet identified a suitable prom, but we will train our staff in the use of it to improve service. For PREMs, data will be obtained once the clinic opens. We anticipate high service satisfaction from patients which assist in the education retention. Another expected outcome we have also include clinical outcomes which monitors the health status and assists with planning and intervention. Again, data will be collected once the clinic opens, but we anticipate obtaining measurable data for patient well-being. An example of data is patient's test result. Using PRMs and clinical outcomes, we will assist the healthcare providers with proper intervention and to implement a reminder system for follow-up appointments. A well-written brochure is a valuable marketing tool business owners can use to attract and inform new customers as well as to attract other investors. My marketing will utilize the acronym AIDA, stands for Attention, Interest, Desire, and Action. To be effective, my brochure needs to get attention, get the prospect interested enough to read further, raise their desire for the family, clinic, or services, and get them to take a specific action such as visit now, call and make appointment, or visit our website. AllCare Family Clinic brochure is a six-panel trifold marketing brochure printed in a letter size semi-gloss paper. Outside will include the clinic logo a healthcare icon with cross symbol, and clinic's slogan, which is our way to impart the basic philosophy of our clinic in a tagline, healthcare with personal touch. Brochure includes basic information such as the location, contact details, clinic schedule, and billing information. Inside the brochure contains all the relevant services information offered by the clinic, such as the test results, consultation, schedule, and instruction, etc. 5,000 copies of marketing brochures throughout the year will be printed all at once to minimize our investment. Our clinic have multiple options for brochure distribution. Countertop display in strategic locations in establishments, leave behind the news sales helpers during presentations, partnering with other companies that will insert our brochure into their packaging, free for displaying and posting brochures on community bulletin boards, mailed to postal recipients. To conclude this presentation, owning a medical clinic is a significant investment a registered nurse makes in their future. The opportunity is ideal for a medical professional wishing to acquire the benefits of owning a business and treating patients as they see fit. Organization and efficiency is crucial to handle all necessary steps. In addition to the higher level financial risk and responsibility, the process of opening a private clinic also involves a considerable commitment of time and money. Those who succeed in their respective fields enjoy a high level of sovereignty and potential profitable career. We need to wear multiple hats, one being a registered nurse, what we were trained to do in nursing school, and the second being a business owner, which is not taught in nursing school. Accepting both roles is precarious in order to succeed in private practice. This concludes my presentation. Thank you very much and stay safe, everyone.